Hello, and thank you for tuning in to our live Q&A where we'll be discussing your questions about the race to find a COVID-19 vaccine. Today, I'm joined by Dr. Pat Winokur. She's an infectious disease specialist, executive dean of the Carver College of Medicine, and she's currently leading the University of Iowa's participation in a clinical trial to study one of the possible COVID-19 vaccines. Please submit any questions or concerns you have, and we'll answer as many of them as we can. Thanks for joining us today, Dr. Winokur.
Thank you for having me. I'm excited to see what people want to learn about.
Same here. Let's start with the first question. What COVID-19 vaccine trials are we participating in here at the University of Iowa?
So we're participating in a phase 3 trial that's sponsored by Pfizer and BioNTech, a company from Germany, and it's evaluating a messenger RNA vaccine for COVID-19. It's a very interesting vaccine. The messenger RNA scares everybody because nobody knows that word, but what it is it's a vaccine that we inject into your arm, and then your body creates the important protein that we think is going to help your immune system learn how to protect you from COVID-19.
That's pretty cool. So we're in phase 3 of this, if I'm correct. Could you possibly explain to us a little bit about the different phases of vaccine development?
So this is an interesting way of studying vaccines, and this is done with all vaccines, including COVID-19 vaccines. We start in what we call a preclinical phase, and this is a time where we're evaluating the vaccine in animals. And we're looking at safety in the animals, and we're looking at whether those animals develop an immune response, and oftentimes looking at that immune response and whether it can prevent infection in the animal. Then we move into small numbers of humans, usually 25 to 50 or so, and we are looking very much at safety at that point in time, because this is the first time we've tested it in humans. We're starting to perhaps look at some different doses. Once we've established that this is safe and it's starting to give an immune response that we think is important, we'll move into a phase 2 study. That phase, we usually study several hundred people. We'll often be honing the dose of the vaccine to find which is the best. Again, following safety very carefully. From that, we look at the data, we look at which dose was the best, which was best tolerated, and we move into a phase 3 study. And in phase 3 studies, we're looking at thousands of people. And the goal there is to really continue to establish safety and really evaluate whether the vaccine is doing what we think it's going to do and hope it's going to do, which in our case is prevent COVID-19. So if you remember, if you've read the newspapers, FDA is going to approve COVID-19 vaccines based on whether they prevent people from getting COVID-19. And it has to prevent infection at least 50% of the time before FDA will consider licensing this vaccine.
So thank you for that background on the development. Is it a guarantee that when a COVID-19 vaccine is approved that it will be effective and safe, or is that still slightly uncertain?
You know, that's the question we're all wondering. In medicine, we always get a little bit anxious when you ask for complete black and white and yes and no. because there's always an exception to the rule. Based on my understanding of vaccines and what I have seen in some of the early phase studies with the vaccines that have been tested, I think we're going to have a vaccine. I think we're going to have a vaccine that works. What I can't answer is whether it's going to protect 50% of people, 70% of people, 90% of people from getting infection, or whether it's going to be long lasting. I think that's a really big question. We don't know how long you're going to be protected before you might be able to get COVID-19 again. And so those will be things that we'll be evaluating.
Yeah, so you touched on something that we're used to with the flu shot, which is that it's never 100% effective. And we understand that. And the perk of that is that even if it doesn't prevent you from getting the flu, it can make your symptoms milder. Will this be the case with the COVID-19 vaccine, do you think?
So a lot of people think that's going to be the case. And I think the flu is a really good analogy. The flu vaccine doesn't work perfectly, but it does often truncate the severity of disease. And flu vaccines need to be given every year. My guess is that this vaccine may not have long-term effects, and you're going to have to get additional doses at some frequency. We don't know whether that'll be yearly, every 2 years, 3 years. That's a guess, but based on what we know about coronaviruses that have been in the population for long periods of time, I think we'll probably have to have booster doses at some point in time.
So I know we're still very much in the testing phase. We're in this phase 3. What do we know about how the vaccine might affect children or pregnant women or others who are maybe more susceptible to health issues?
So that's a really good question. The study that we're performing at the University of Iowa, and almost all of the studies that are being tested now in phase 3 around the world, are being tested in adults. Now, our study, we're testing ages 18 to 85, so we're at least including the elderly, which we know is a population that can have severe effects from COVID-19. But what we're going to need to do is turn around and study the vaccine in children. And another important population that we often need to really specially study are pregnant women. We know that the pregnant women can have serious effects from COVID-19, so it would be an important population to try and prevent infection if we can. And obviously, there are people out there that have diseases that compromise their immune system. We'll be doing special trials looking at their responses to vaccines as well.
Great. And so we'll probably be testing the effects on people for quite a while. I think it's around 2 years. Mm-hmm. Will it be the full 2 years of that testing before we see a vaccine, or could an effective vaccine be approved before that 2-year period is over?
So that's a really important question. When we are studying vaccines, we are really looking at them in an extremely rigorous way. So for this study, we're looking at 30,000 people around the world. The first 6,000 people, every day for a week after they've had the injection, we're asking them, do you have a sore arm? Do you have a fever? Do you have fatigue? Really rigorous, standardized questions. Every time we see them, we are asking them if they have any changes to their health. Did they have to go to the emergency room? Did they have to start a new medicine because something cropped up? We are collecting safety. We will be doing that for 2 years. But oftentimes we can go ahead and approve a vaccine after we have followed people for a period of time. Usually it's about 6 months keeping that data going for 2 years is icing on the cake. And that's starting to address the question, is there anything long-term that was unanticipated? And we do that even when we start approving vaccines and then put them out into the general public. We continue to watch, are there any side effects that we weren't expecting? And that's something that's part of our whole vaccine delivery system in the United States, and it's very important. The other thing that'll be good about continuing the study for longer is we'll be watching blood antibody titers, and we'll be watching to see whether they get COVID-19 over 2 years. So that helps us understand how long those antibodies are in your bloodstream and whether the vaccine is actually still preventing you from getting disease. So I think that they would approve it before the 2 years. I'm pretty sure they would in a pandemic situation, but we're going to be getting important data no matter what.
Yeah, so even if a vaccine is approved, this is kind of a long haul situation where we're really going to be looking to learn more about the virus itself and how long immunity lasts, as well as just continuing to look at any side effects from the vaccine, right?
Absolutely. And we continue to do that even once a vaccine is marketed. We have systems in place through the CDC that look for adverse events that were unexpected. And that's something that we're always submitting as physicians and public health workers to the CDC so that they can coalesce that data from around the country.
Right. You've already touched on the fact that although this feels, I think, to the general public like this process is moving quickly, you've really explained to us that there's a lot of processes in place to make sure that, yes, even if it's quick or quicker than we might think, it's still safe. But there's a lot of concern out there in communities, and we hear about it a lot on social media, of people wondering, how could this possibly be moving so quickly? How could we possibly have a vaccine in the next, 6 months or so? Can you explain to our audience how speed might be affecting it or might not be affecting it, and how effective and safe this vaccine could be?
Right. So I think there are a couple things in that question that are really important. The first one is safety. And we are not compromising any of the safety of this vaccine production. What we have done is we've created protocols that have very set ways that we're going to move from phase 1 to phase 2 to phase 3. So instead of stopping one, rewriting the protocol, starting the next phase, stopping it, rewriting the protocol, they really comprehensively put the phases into one protocol, and that just helps with the regulatory background. But the other thing, which I think is the other really important thing to think about, a lot of Operation Warp Speed, which is, I think, one of the reasons why people are anxious, is it sounds really fast, is that we are allowing, and the government is subsidizing these companies not to do the research and development part, not to do the clinical trials, but to start the manufacturing processes and start to actually ramp up the number of doses of vaccine before they know whether their vaccine works. If this vaccine doesn't work, those vials are going to get thrown in the garbage and they'll never be used. So the government has accepted some of the risk for the companies in allowing them to go through that manufacturing process, which is expensive, so that they will have doses ready as soon as the FDA thinks that this vaccine is an acceptable vaccine, it's safe and effective. So that's where a lot of that speed comes, is in the back end of the manufacturing.
That's really helpful to know. Thank you for sharing that with us. So we talked a few minutes ago about the fact that the vaccine may not be 100% effective, but it will have effectiveness when it's approved. Why would it still be important for people to get the vaccine, even if it's only, say, 40% effective?
So this is the story of trying to reduce the symptoms. So oftentimes vaccines that are not perfect will reduce your symptoms once you get an infection. And that's true with flu vaccines. Oftentimes, if you didn't get that vaccine, you might be much sicker. You might even end up in the hospital. Having that kind of partial immunity would be a way of thinking about it. It helps reduce your symptoms. And then also, it oftentimes reduces the amount of virus you shed. And so that reduces your risk of transmitting it to your family members, your coworkers, your fellow students in school, everyone else.
Great. Well, if you're just joining us, we're here with Dr. Pat Winokur, infectious disease specialist here at UA Healthcare, talking about the COVID-19 vaccine. Please comment with your questions or concerns, and we'll answer as many of them as we can throughout this discussion. So, Dr. Winokur, we've had a few people ask on Facebook about individuals who are immunocompromised and whether or not they'd be good individuals or good candidates for a clinical trial for this vaccine. Could you touch on that and as well as maybe if we're looking for other kinds of people to sign up for the clinical trial?
So we are looking for those that are 18 to 85. And in this phase 3 trial, we are allowing people to enroll if they have very stable diseases that could be immune mediated in nature. What they can't be is on some of the really potent immunomodulators. So there are drugs now that are really good at reducing your immune response, so your disease is improved. That would be an exclusion, but we are allowing people that do have immune diseases, but just aren't on those medications. And eventually, we'll be expanding into studying those who have even some of the immune modulators. And others have done other clinical trials with other vaccines, and some of those people still respond nicely to vaccines. They still develop the antibody response that we're wanting. So just because you're on those medications doesn't necessarily mean that you won't get an immune response.
So you touched on something that is familiar to all of us with flu season, which is one of the reasons we want people to get the flu shot is to protect those around them, right? To make sure that if there are people who cannot get the flu vaccine, that they're protected by the rest of us doing our part. Will it be the same idea with the COVID-19 vaccine?
I think it's going to be very interesting. So not only is the manufacturing and the study of vaccines going on, there's a lot of discussion of how best to deploy the vaccine. Early on, we probably won't have enough doses for every person in the country. So who do you start with? And that's been a debate that's going on in the background with a lot of the vaccine experts in some of the committees that decide who gets first crack at the vaccines. It might be the elderly, because they have been so disproportionately affected. It might be those with high-risk conditions like hypertension, diabetes, obesity. They would be prioritized. And then obviously essential workers are going to be prioritized, the healthcare workers, because we have to have places for our patients to be taken care of. And then some of the other essential workers that are out keeping the food sources going and perhaps classrooms going, things like that. But eventually, I think you're going to see that they're going to want to expand it to as many populations as possible.
So we're definitely looking at, I mean, if we're using our crystal ball here, we're looking at least getting through flu season before we have a vaccine. And so I think there's been some hope out there that we'll just have a vaccine and then we won't really need to worry about all these precautions we've been taking. But would you say, as an infectious disease specialist, that really we shouldn't just put all of our eggs in the vaccine basket and we should continue to still wash our hands often, social distance, all the things that we know prevent the spread of COVID-19?
So that's going to be the most important thing we can do for really quite a while. I don't think we'll have a vaccine available before Christmas time. There's a lot of time between now and then where people are coming in contact with people that have COVID-19. And the best way to prevent it is masks, face shields. We're using those in the University of Iowa hospitals and clinics as well. Hand washing, social distancing. It sounds monotonous. People I know are getting tired, but it's so important because that's how we can reduce spread. And we need to reduce the spread now. Eventually, we're going to have a vaccine, but don't count on it for a while. It's keep up all the precaution measures that you can.
That's a great reminder. And you're right. I think everyone is tired of it at this point, but I keep hearing this phrase, just because we're tired of COVID-19 doesn't mean it's tired of us. And so we have to stay vigilant.
Unfortunately, that's true.
Mm-hmm. So Anne on Facebook asks, how will the vaccine be allocated and distributed when approved? So you already said that it may not be available to everyone, but do you have any idea about how it will be distributed?
So they have not released that strategy yet. I think that's a really good question. I would love to know the answer too. Again, my guess is they're going to go for the most vulnerable, the ones that have had the most severe disease. I think that's going to be the elderly and those with high risk factors, and then essential workers. I think that would be my best guess, but I have not seen that in writing yet. And I know those discussions are going on.
Great. So we've already mentioned flu season a couple times in this conversation, but flu season is right around the corner, which seems crazy. But with both of these viruses circulating this season, is it still important to make sure you get your flu vaccine this year?
So it's going to be more important this year than ever. And there are a couple of reasons. One is we do sometimes see patients that get co-infected, that they could get flu and COVID-19, and that could be devastating. The severity of COVID-19, and we already know 45,000 people die from influenza a year. If you mix those two together, it would be terrible. The other thing we know is even people who have recovered or had COVID-19, they often have some lung damage that's still present. Some of them feel like they have asthma type symptoms. And then you add another insult onto it, like flu, that could, again, be something that could really trigger some bad responses. And so it's more important than ever. And that's even not even thinking about how difficult it's going to be figuring out what you have. Because the symptoms overlap a lot. And we do have drugs for influenza. We have Tamiflu. Again, not a perfect drug, but we're going to have to figure out who's got what so that you get the right therapy. And we're already stressing our testing stations pretty aggressively. And when you add flu onto that, it's going to be really difficult.
So again, that's just another reminder that precautions could not be more important right now. We want to prevent the spread of both COVID-19 and the flu. So staying home if we can, wearing face coverings when out in public, using hand sanitizer, washing hands for 20 seconds. What any other strategies that you would like to remind our audience about just to continue doing throughout flu season?
So those are the really important ones. If we were lucky and people were really diligent with all of those measures that you just mentioned, we may see less flu than we normally do. Maybe we would have fewer people dying from influenza too. That's a win right there.
Yeah, absolutely. And again, I want to emphasize, I think we both agree, we're all kind of tired of these precautions, but it's probably a good practice to get into throughout flu season, like you said, so that we can hopefully have less people catch that virus and get sick.
That's exactly it. And I just hang in there. That's my recommendation. Hang in there. We will get something. I think we will have a vaccine just not quite there yet. Keep
Yes.
hanging in there.
So Kristen asked on Facebook an interesting question. News reports have been coming out that someone, I believe it was in China, was reinfected potentially with COVID-19.
Yep.
What do we know about that, or how a vaccine might prevent reinfection?
So that's a really important finding, and that was why I was kind of alluding to the fact that I think this vaccine might be more like influenza vaccine. We know that the influenza vaccine typically doesn't last more than 6 months. Now, the good news is flu really is seasonal. And most of the time, you get your vaccine in October and you're protected through flu season, which ends in March, typically. Coronavirus isn't showing that seasonality. And the fact that we have individuals that have gotten reinfected in 4.5 months suggests that this may not be a vaccine that lasts forever. But what that data did show is that the reinfection symptoms were very benign. And so getting the vaccine, even though it may not be perfect and long-lived, we're hoping that it will reduce the symptoms, similar to what we saw in those couple people that have been reinfected.
That's kind of a silver lining of what the data we're seeing.
Mm-hmm.
Hopefully that's the case.
Yep.
If someone would like to participate in the clinical trial we have here, is there a way they can sign up online or find more information?
There is, and I think in the background you have a web link that we will be putting out there that you could click on. My easy way of doing it is go to Google, type clinical trials at University of Iowa, and then look for COVID vaccine trials, and you'll be able to find it there. And there's a link that you can express interest.
Great. And I believe we have it in our comments. So between either using Google or finding it in our comment section below, you should be able to find that. We're just about out of time, and I wanted to give you a chance, Dr. Winokur, to share anything else you wanted to share with our audiences, whether it's vaccine related or just about COVID-19 in general. Is there anything you'd like to leave us with?
I think people have done a great job, and it's continue with that. Social distancing is getting tiring. I get it, but it's really important, and we are making a lot of progress. I don't think this vaccine is being rushed in the terms of jeopardizing safety. We are learning so much. And remember, the government actually, there are at least 6 different companies with 6 different vaccine types. They've been made in different ways that we're working on. And that's going to give us a lot of opportunities to pick the best one, the safest one. Maybe one will work better in certain populations than others. But the fact that we have that bet that we didn't put it on one horse, we put it on 6 horses is really important, because I think we have a lot of opportunities. So there is hope out there.
That definitely gives me hope, for sure. So thank you so much for sharing your expertise with us today, Dr. Winokur.
Thank you.
And thank you to everyone who tuned in. If you joined after we started, please go back to the beginning of the broadcast to hear all the great information Dr. Winokur provided for us today. And stay tuned to our social media and our website, uihc.org, for all the latest information about COVID-19 and vaccine development as we have it. Lastly, please remember, wash your hands often, wear a face covering when you're in public, and keep a safe distance from others while you're in public, and take care of your physical and mental health. Thank you for watching.